If your spine pain has gotten so bad that standing, sitting, or even sleeping feels impossible, these 5 doctor-approved stretches can instantly take pressure off your spine and give you relief. But before you try anything, there's one common stretch most people do wrong that actually makes severe spine pain worse, and I'll show you how to avoid it. Let's start with the first stretch. This one helps reduce pressure quickly. Stretch number 1, knee to chest reset. This first stretch is one of the simplest ways to reduce pressure in the lower spine when you're dealing with severe pain. Start by lying on your back with both legs extended and your spine in a neutral position. Slowly bring one knee toward your chest, using your hands to support the movement rather than pulling aggressively. Keep your shoulders relaxed and hold the stretch for about 10 to 15 seconds. You're looking for a light release, not a deep stretch. If the pain is intense, use a smaller range of motion and move slower than you think you need to. After holding, gently return your leg to the floor and repeat the same movement on the other side. You can do this 2 to 3 times per leg if it feels comfortable. Most people notice a soft decompression in their lower back as the hip flexors relax and the spine unloads. If your pain tends to travel down the leg, the next stretch is designed to help calm irritated nerves even further. Stretch number 2, pelvic tilt for nerve relief. This next stretch helps calm irritated nerves in the lower back, especially if your pain shoots down the leg or feels sharp when you stand up from a chair. Begin by lying on your back with your knees bent and your feet flat on the floor. Gently tighten your stomach muscles and slowly tilt your hips backward so your lower back lightly presses into the surface beneath you. This movement should be small, just a subtle flattening of the lower spine. Hold this position for 5 to 8 seconds, then relax and let your spine return to its natural curve. Repeat this motion 8 to 10 times if it feels comfortable, keeping the movement slow and controlled. If lying on your back is too painful, you can perform a smaller version of this while seated by gently rolling your hips forward and backward in tiny motions. The goal is to help the spine move without strain and give the nerves more space. Many people feel their lower back muscles loosen within the first few repetitions. If your back feels stiff in the mornings or after sitting a long time, the next stretch will help restore mobility even more. Stretch number 3, gentle cat-cow mobilization. This stretch helps restore gentle mobility to a stiff spine, especially if your back feels tight when you wake up or after sitting for long periods. Start on your hands and knees with your wrists under your shoulders and your knees under your hips. If this position is uncomfortable, place a folded towel under your knees or use the edge of a bed for support. Begin by slowly rounding your back upward, letting your head drop naturally. Hold this rounded position for 3 to 5 seconds, then move in the opposite direction, gently lowering your stomach toward the floor while lifting your chest slightly forward. Keep the range small and avoid any sudden dips or dramatic arches. Move back and forth between these two positions 8 to 10 times, keeping the motion slow and steady. If being on your hands and knees is too painful, you can perform a seated version by gently arching and rounding your back while sitting upright. The goal is to help your spine glide smoothly and reduce stiffness without strain. Many people notice their lower back and mid-spine loosen up after a few cycles. If your pain tends to flare up suddenly, the next stretch provides a calming release that most patients find immediately soothing. Stretch number 4, supported spine and hip release. This stretch is designed to calm the spine during flare-ups, especially when your lower back feels locked, tight, or strained. Start by kneeling or sitting in front of a stable surface like a couch, bed, or a stack of pillows. Slowly lower your upper body forward, allowing your arms to rest on the surface while your hips sink back toward your heels. You don't need to reach far. The goal is to let your spine lengthen comfortably. Hold this position for 15 to 20 seconds while taking slow, controlled breaths to help your muscles relax. If kneeling is uncomfortable, you can perform a seated version by sitting in a chair and leaning your upper body onto a table or pillows placed in your lap. Keep your neck relaxed and avoid pushing your chest toward the floor. The movement should feel gentle and supported. Repeat this stretch 2 to 3 times if it feels good. Most people notice a soothing release across the lower back and hips as tension begins to ease. This position reduces pressure on the spine without forcing movement, making it ideal for severe pain days. The final stretch offers one of the safest ways to relieve intense lower spine pressure. Stretch number 5, supported spinal decompression. This final stretch is one of the safest and most relieving positions for intense lower spine pain, especially when sitting or standing makes the discomfort worse. Start by lying on your back near a couch, bed, or sturdy chair. Slowly place your lower legs on top of the surface so your knees are bent at roughly a 90-degree angle. Your calves should be fully supported, allowing your spine to settle into a neutral, relaxed position. Once your legs are elevated, take slow, steady breaths, letting your lower back soften into the ground. Stay here for 20 to 30 seconds at first, and if it feels good, remain in this position up to a minute. This gentle posture reduces pressure on the spine, relaxes tight muscles, and allows irritated nerves to calm down without any stretching or bending. If you prefer, place a small pillow under your head to support your neck. Avoid lifting your hips or arching your back. The goal is pure relaxation. Many people feel their pain begin to ease within the first few breaths. This is often the first position recommended when someone is experiencing severe spine pain because it safely unloads the lower back and promotes natural decompression. These 5 stretches are simple, gentle movements designed to ease pressure in the spine and help calm irritated nerves during painful flare-ups. You don't need force or long routines. Just slow, controlled motion within a comfortable range. Repeat the stretches that feel good and use the supported positions on days when pain is stronger. With consistent practice, many people notice improved mobility, less stiffness, and better day-to-day comfort. If your pain continues getting worse or isn't improving with home stretches, you may need a professional evaluation. If your pain has been getting worse, lasting longer, or making it difficult to work or sleep, professional support can make a major difference. Texas Back Relief works with patients across the Dallas-Fort Worth area who struggle with severe back, neck, and spine conditions. Our specialists see cases like yours every week, and many of the techniques shown in this video come from routines used in real patient care. If your back or neck pain is severe, persistent, or starting to affect your daily life, you don't need to wait. For a free second opinion, call Texas Back Relief, and a team member can help you schedule a visit. You can also learn more on our website. Getting the right evaluation early can help you avoid long-term problems and find the treatment plan that's right for you.